Section 2. Positive behavioral strategies and restrictive measures.
Positive behavioral strategies. Positive behavioral strategies are proactive approaches to changing challenging behavior. Some examples of positive behavioral strategies are pre-correcting, prompting, and nonverbal signals. Positive behavioral strategies encourage you to see behavior as a form of communication. Every behavior sends a message about what a person needs. Some messages are easy to read. Some need more deciphering. Instead of reacting to challenging behaviors, you can proactively reduce them. Here's how positive behavioral strategies can help DSPs do that. Help build a trusting relationship between DSPs and the people they support. Instead of seeing someone's behavior as a problem, practice empathy by looking at the people you are supporting with compassionate curiosity. With this view, you can shift your focus from fixing people to understanding them. You can also develop a more collaborative relationship with people by working together to understand when and under what circumstances a behavior occurs. Reinforce new skills. Once you understand why a person is behaving a certain way, you can respond more effectively. You can help them learn new behaviors that serve the same purpose, like how to follow directions or ignore peer distractions. Prompt you to consider multiple reasons for behavioral difficulties. Challenging behavior can happen for many reasons. People may not have the language or communication skills to express what they need, or the behavior could be a way to avoid a difficult situation or task. In other cases, some people may be reacting to an environment that is not supportive of their needs. Or there could be a cultural difference, which may prompt you to take a culturally responsive approach to analyze the behavior and your response to it.
In the past, the first choice in addressing risky behavior for people with developmental disabilities often included techniques like denying food, applying restraints, or using medications to control a person. Today, laws have been passed to ensure that people with disabilities are treated as equal citizens with the same rights and freedoms given to Ohioans without disabilities, and are empowered to promote their dignity, respect, and trust. Ohio's rule governing behavioral support strategies that include restrictive measures provides instructions about what you, as a DSP, can and cannot do, and what you should and should not do based on any behaviors that you may see. Prohibited measures are actions that a DSP, under no circumstance, can take. The following actions are all prohibited measures and should never be utilized while you are supporting someone. DSPs should only implement restrictive measures that are included in someone's ISP and that they have been trained on. Disabling a person's communication device, restraints in which the person lies face down, denial of breakfast, lunch, dinner, snacks, or beverages, a restraint that has the potential to inhibit a person's ability to breathe, or one that is medically contraindicated, meaning it could have an adverse effect on the person's physical health. Placing a person in a room with no light, subjecting a person to damaging or painful sound, application of electric shock to a person's body, subjecting a person to any humiliating or derogatory treatment. If you are asked to implement a prohibited measure or observe a prohibited measure being implemented, you should report it as a potential MUI immediately. squirting a person with any substance as an inducement or consequence for behavior, using any restrictive measure for punishment, retaliation, instruction or teaching, provider convenience, or as a substitute for specialized services. Non-restrictive measures. Providers of services must first attempt actions or supports that are non-restrictive to address the risk of harm before a restrictive measure can be approved and put in a person's ISP. After the non-restrictive actions or supports have been documented as ineffective, the county board must assess the behavior, develop support with the person's team, get informed consent from either the person or, if applicable, their guardian, and finally seek approval from a human rights committee. Some people with developmental disabilities have behavioral support strategies in place to help support and protect them. These strategies may include restrictive measures, and it is important to consider what you have learned about trauma-informed care when supporting people who require these measures to be used. A restrictive measure is a method of last resort used to keep people safe, such as restraints, timeouts, or restricting a person's rights. Restrictive measures can be used in a behavioral support strategy when there is a direct and serious risk of physical harm to the person or another person, or a risk of eviction, arrest, or incarceration. After the non-restrictive actions or supports have been tried and failed, the county board or ICFIID must assess the behavior, develop the restrictive measure with the person's team, get informed consent from either the person or, if applicable, their guardian, and finally seek approval from a Human Rights Committee, or HRC. Next, we'll learn about the types and limitations of restrictive measures. A restriction of a person's rights is any restriction that impinges upon the rights of people with a developmental disability, as listed in the Rights of People with a Developmental Disability. For a dietary or food restriction to be approved, there needs to be an assessment which includes a clear, serious, and a relatively immediate risk of harm should the recommended diet not be followed. For example, a physician orders that consumption of soda pop be limited to 1 can per day as a means of controlling weight and possible future medical problems. In this case, the risk cannot be reasonably stated to be in the near future or a certainty. However, if a physician orders a textured diet or else the person has a high risk of choking, a rights restriction could be put in place. A timeout can be one of two actions: physically removing a person from their immediate environment and placing them in a different setting and preventing the person from leaving, or preventing a person from leaving a specific area. A chemical restraint is a medication prescribed to control or alter a specific behavior. Chemical restraint does not include medications prescribed for the treatment of a diagnosed disorder or medication that is routinely prescribed in conjunction with a medical procedure for patients without developmental disabilities. A mechanical restraint is the use of a device to restrict a person's actions, such as wrist straps, mittens, or a harness in a vehicle. If a mechanical restraint must be used to avoid the risk of harm, then the provider must cease restraint immediately once the risk of harm passes, not cause harm or pain, and not restrict the ability to breathe. A manual restraint is a hands-on method that restricts the head, neck, one or more limbs, or the entire body, using enough force to cause the possibility of injury. It includes holding, disabling, or blocking a person's wheelchair or other mobility devices. If a manual restraint must be used to avoid the risk of harm, then the provider must maintain constant supervision, cease restraint immediately once the risk of harm passes, not cause pain or harm the person, and not restrict the ability to breathe. In a crisis or emergency, restrictive measures may be needed to ensure a person's health or safety. For example, to prevent a person from being hit by a car, a DSP uses a safe manual hold to stop them from falling into a busy street. In ensuring the person's safety, the DSP has used a restrictive measure not written in the person's ISP. Anytime a restrictive measure is used without HRC approval, the incident must be documented and reported as an unusual or major unusual incident. Court-ordered restrictions are not considered restrictive measures for purposes of behavioral support planning and are not subject to HRC review. However, care must be taken to ensure that actions used to support or implement the court order are not restrictive. For example, if a person is prohibited by a court from consuming alcohol and a support team proposes to search the person's room for hidden alcohol, then this would be considered a violation of rights. The court simply ordered the prohibition of alcohol use, not to search the person's room.